As a trainee here at CHA, I've been really happy to find a like-minded community of faculty and trainees who are similarly dedicated to helping raise the voices of those who are less heard in our patients, in our trainee programs as well.
This is a place where diversity is really valued, that you will be able to provide care for different patient population, and also this is a place where there's diversity in our workforce, and there's a sense of comfort here based on respect for our differences.
I want to say that URIM voices or minority voices in the training programs here are definitely heard. They're heard by the program directors, by staff and administrators, leadership, as well as trainees.
Respect is sort of the foundation. If you have respect for what's different, if you have respect for others, then that's the starting point of establishing a good relationship, and this is very important in healthcare.
What we do well is, from my experience, creating an environment where everyone's voice is welcome at the table. It's a place where you can feel supported no matter where you come from or what your background is. Walking into a meeting or a work group, not everybody looks like me, and that's fine, but everyone listens to me and everyone cares about my opinions and my thoughts and my perspective and point of view, and that is an incredibly empowering space to be training in.
So I think one thing that I appreciate is because it's a smaller hospital, the residents have more of a role in the shape and guidance of where the hospital goes. I think it's much more important than painting a rosy picture of a particular place to show that we actually have power to engage with people within the hierarchy to fight for what we feel is right. We matter to a much greater degree, I think, because of the relationships that are present and the community nature of this small hospital.
I think there's a strong recognition, especially right now, that given that we do have a fairly diverse patient population, and it is really important that we are also training physicians who share these backgrounds. Ultimately, that is what CHA is about. It's about health equity. It's about promoting the health of our community, and also really the conversation right now is really about how do we show that in our workforce, in our hospital, in all levels, because that's going to be reflected in how we take care of our patients.
CHA is widely known as being an organization that has a diverse patient population. Within our primary care panel, 43% of patients are receiving care in a non-English language. That's about 22,000 patients receiving care in Portuguese, about 13,000 receiving care in Spanish, nearly 8,000 receive care in Haitian Creole, and we serve a total of about 80 languages a year.
When you come here, you might feel like, I don't know a lot about all of those cultures. I don't speak any of those languages, or maybe you do. And sometimes you can feel like overwhelmed sometimes by the amount of cultural competency you're supposed to have. So we don't really teach people how to be culturally competent. You're never going to understand what it's like to be from another country. If you're not from that country, you won't understand their culture. But what we hope people will develop here is a cultural humility and ability to open their minds and see the patient as somebody that they're learning from, and make it easier for the patient to have access to us and everything they need for better health outcomes.
This really is the place to be if you have it in your heart to serve the underserved, the uninsured, the undocumented, and the diverse, linguistically, ethnically, racially. This is the place to be.
So there are endless ways that CHA is engaging in justice work. One thing that I love about it is while we have a lot of these very particular coursework, classes, particular initiatives happening, it's built into the marrow of Cambridge Health Alliance. And there's a beauty and a finesse in the way that they choose to bring those issues to the forefront when we're talking about trauma, or to the forefront when we're talking about severe mental illness and chronic psychosis. Those things are always in the conversation here. As someone who identifies as gender fluid myself, it has also been a joy to work with a therapy patient, for example, who is non-binary, transmasculine, and for them to feel that they've really just felt that CHA has provided deep care for them that has been compassionate, that has been in stark contrast to many of the ways that they've experienced mental health care in the past.
Being around the genuine people that earnestly care about me as a person has been hands down the most moving and powerful experience. That's irreplaceable. And that's something that you won't find on a website. You won't find that. You won't find it in a brochure. You'll only truly know by experiencing that. It's probably the best part about this program, aside from, really great training and great resources for our patients, feeling like a person here while I'm training. It's been amazing.
CHA, I think, does a lot of things really well, but I think it's now positioned in a place, and there's enough people here who really have a will to say, okay, well, we've done a good job, but the status quo isn't good enough. And we really need to be the leader in all these things. We need to be the leader in health equity. We need to be the leader in racial justice. We need to be the leader, in social justice. This is what we do, and we need to be at the forefront of that. And I think that's where we are right now here, is that we are at the cusp where we're seeing a really increase in activity and an increase in conversation about how do we take this forward? How do we go into the next era? And that is an exciting moment to be in.